I grew up in Chicago. We were poor. My parents, they each immigrated from Eastern Europe, and they met in Chicago, and they had to make a living. Family members who had come before them had gotten into the hand laundry and dry cleaning business. So that's what they did. They opened a small hand laundry and dry cleaning shop on the west side of Chicago. We lived in the back of the store in order to make ends meet. That allowed me to see and hear much. The customers, they were poor by and large, African Americans and Latinos. Some of them had a job. Those who worked had low-paying jobs. They got paid, those who got paid, on a Friday, and we needed to have a good Saturday in the store in order to take in enough money to pay the bills related to the business. And how that Saturday went determined how we ate the following week, whether there was a quarter left over in those days for a movie. And so my mother, who had abilities as a seamstress, she could sew, decided to do alterations because there was no overhead on that. Whatever she made in shortening somebody's trousers or repairing a seam, that was money for which we didn't need to pay a bill. And she treasured the time that she had to create that revenue. Now here's what I saw over and over again. My father would take a garment in for cleaning or washing and notice that the pocket was ripped, something was torn, and in a very tentative way, he'd come over to my mother and he'd say in Yiddish, because we spoke Yiddish, "Na, nail him up. Here, sew him up." And I could script the rest of it, because my mother would say back to him, "Batzuln," meaning he's going to pay. To which my father would say, again, I could script this, "Is a zerrissener, hat nicht kein Geld." He's in tatters. He has no money. Compassion, yes. Empathy, I saw that. But I also saw the other side. You got to get paid. So they didn't realize they were teaching me this, and I didn't realize I was learning it at the time. But there was the lesson. No money, no mission. And now today, as a president, and happily as a physician who still sees patients, I understand no money, no mission. In my case, as a physician, I care for children with gastrointestinal diseases. Most of them come from the community near our academic medical center. Roughly 3/4 of them are on Medicaid. Each time I or one of my colleagues sees a patient on Medicaid, we lose money. That's a national phenomenon. Medicaid generally pays 1/3 or more less for a visit than for the visits of those who are fortunately, quote, well insured. And you know that old expression, you can't make that up on volume. Now, fortunately, I work in a large group practice with multiple sites. So there are many patients in the other sites that tend to help make up the loss. But most physicians and other providers across the country don't have that luxury. They can't do it. In fact, it's estimated that over 40% of physicians around the country limit the number of patients supported by Medicaid that they see, or don't see them at all. No money, no mission. Now, you probably think that I'm going to follow this by making a plea for more money overall. That would be great. But I want you to consider another thought in terms of dealing with this no money, no mission issue. I'll tell you a story. When I was a professor of pediatrics in another academic medical center, I became interested in providing home care for children associated with our academic mission. In other words, there are children who need follow-up care which can be done at home at less expense than in the hospital, or sometimes care that can be done at home in lieu of the hospital, potential for savings. So my colleagues who did intensive care in that center and the endocrinologist came to me one day and said, maybe you can help. We have an 8-year-old child with diabetes, and she recurrently presents to the hospital and requires very expensive intensive care unit care because she's out of control. Diabetes out of control is a very serious issue. And she'd come back recurrently with her diabetes out of control. Physicians often have cute explanations for things we don't understand. And in those days, we used to call it brittle diabetes. She was brittle. So we sent a home care nurse to her apartment. And here's what the nurse reported when she came back. The mother was drawing up the insulin in a dark kitchen. In fact, the whole apartment was dark. The electric had been turned off long ago because she couldn't pay the bill. We found ways to pay the bill. No more brittle diabetes. Apart from the money, no more suffering in the intensive care unit. There's money to be had. I'll tell you another story related to my experience in home care and to my interest in children with feeding disorders. What does that mean? 2 to 3-year-old kids who are highly food selective. They only eat white round food or the corners off saltines. These are true experiences. Or they've had long-standing esophagitis, pain on swallowing, so they learn not to eat. And you can help those children and their caregivers by keeping them in a special setting, in a hospitalized setting, for 8 or 10 weeks, and working with them painstakingly each bite. But then you just can't send them home and tell the parent to simply follow what she's been taught. There needs to be some aftercare. Well, that would be done through the home care program, where we'd send out a nurse on a regular basis to each of these homes to follow up. Now, my home care offices were right across the road from a wonderful child care center. So I had an idea. I thought, you know, if we could get 8 of those kids aggregated in a child care center, which would have benefits for them anyway, and one nurse who might come and take care of their needs at the child care center, and they could sit around a table for lunch. When 3-year-olds sit around a table for lunch, they eat very well together. They reinforce each other. And as far as the numbers were concerned, when I penciled it out, if the agency responsible for supporting their home care would pay for the child care tuition and the nurse for 8 kids over the course of a year, you could save $100,000. So I presented that. And here's what I heard back. We don't pay for child care. And by the way, if these children can be in a child care center, they're not homebound. And, you know, if we could think about how we could expand what health care is, we could save a lot of money. If we could find a way to understand that paying for an electric bill is health care, that paying for child care is health care, that paying for keeping the lead out of a child by de-leading the house after they've been lead poisoned is health care, if paying for an Uber to take somebody to a visit rather than to call the ambulance, maybe there would be some money left over. And with that money, we take care of the no money, no mission issue. We find a way to be innovative, creative, broader-minded, so that we can address the needs of the people who are very bound to the mission, the people who nay people up, the people who sew people up, so that we can all be better kept in good repair. Thank you.